I'm a pediatrician. I don't see a lot of breast cancer in my world.
Dr. Megan Coggin loves helping others in her role as a pediatrician. But in May of 2022, she found herself the one needing medical advice.
I was nursing my 8-month-old when I noticed a lump in my right breast. I thought at the time that it was just a side effect of nursing, a clogged milk duct, or the beginnings of mastitis, which I had had before. I thought little of it. And shortly thereafter, my milk supply went down drastically. And it turns out that my breast milk supply dried up because I had invasive ductal carcinoma of the breast.
At just 33, Megan faced a life-changing diagnosis.
Most breast cancers in general goes straight to surgery. And for me, I started chemotherapy. I had 6 rounds of chemo, and then they gave me a 4 to 6 week gap of kind of recovery time after my last dose of chemotherapy before I had a bilateral mastectomy on December 23rd of 2022. And then after my mastectomy, I had 6 weeks of recovery time, and then I started 6-week, 30-day radiation therapy.
All that treatment took a toll on Megan and her body, both emotionally and physically.
For a while, I was joking that I had little T-Rex arms because I couldn't reach more than, like kind of an elbow's reach away. I couldn't lift my children. I had a weight limit that I could pick up.
Part of Megan's recovery involved rounds of physical therapy with Mary Freebed at the Cowell Family Cancer Center in Traverse City, all under the watchful eye of physical therapist Kelly Nash.
And then if that's easy, I'm gonna have you come a little lower, because I think you can handle this now, onto the bar, feet back a little bit. When I started seeing her, she was not working at all. She was feeling, lack of endurance. She really was fatigued still from chemo. She was just feeling like she was super weak. How has your strength been?
Good, I think. It's gaining.
Megan slowly started regaining her strength with an aspect of cancer treatment many patients don't think about when they first get the diagnosis.
So we are treating post-surgically. We're treating scar tissue. So working on just getting the tissue moving again, working on getting the joints moving again. Very normal. It takes a while. So you're working on it. That's what's most important.
Now, nearly a year after her mastectomy, Megan is back to doing what she loves as a pediatrician and, most importantly, as a wife and mother.
The biggest joy, I think, through this whole process was when I was able to finally lift my, at that time, my 18-month-old. And that when I just kind of swooped in and picked him up, and it was like a reflex. But that was a huge victory.
And she has this message for those facing a similar journey.
You can do this. You can get through it. And the attitude is the biggest factor, I think. Studies have shown it, but I have lived it. And if you can have that, if you can keep that positive attitude and find that silver lining and the grace in this awful experience, that's going to take you a long way.
In Traverse City, David Leiden, 9 and 10 News.